Good afternoon, everyone. My name is Sherry Goldsmith. I'm the Chief Nursing Officer at Sky Rehab Hospital in Bowling Green, Kentucky, and I'm here to talk to you today about stroke, and that after stroke, there is hope. But first, I want to talk a little bit about stroke and how it affects the brain. Stroke is an illness that affects the brain. There are two types of stroke. There is ischemic stroke and hemorrhagic stroke. Ischemic stroke is where a type of stroke that a clot or a blockage blocks a blood vessel and the brain does not receive blood in that area of the brain. A hemorrhagic stroke is where a vessel is ruptured or broken and blood goes into the area of the brain. Both of those types of strokes can cause severe changes in our bodily functions, whether that be memory loss, speech and communication challenges, whether that's a slowed speech or a slurred speech, or the overall communication message that comes from our brain, and as we try to articulate that into speech. It could also be a type of paralysis, whether that's a left-sided weakness, right-sided weakness, affecting the upper half of our body or the lower half of our body. We could have seizures, we could have fatigue, just this overwhelming sense of tiredness. We could have mood behavior changes, whether we feel anxiety or frustrated or even depressed at times. So the brain, as a complex organ, can affect us in many ways. And for Stroke Awareness Month, we would like to tell you what we here at Sky can do to help you and give you or your loved ones hope after having a stroke. If you or your loved one have experienced a stroke, I do want to tell you that there's hope. And at Sky Rehab, we offer such a specialized team that are focused and trained specifically to help you or to help your loved ones recover from a stroke. Within 3 months of having a stroke, your brain is like a sponge. It wants to heal, it wants to learn again, and it wants to try to rebuild those connections to understand what the baseline is. So if you have suffered paralysis or weakness on one side or another of your body, the brain wants to help and re-heal those pathways. So whether that's coming in to our facility and receiving that continuity of care with your therapist, being a physical therapist that will help you with strength and balance and rebuilding, to our occupational therapist that will help you with those fine motor skills, everyday living exercises, whether that's how to put your socks back on or how to eat properly. With nutritional services, whether you get your speech therapist to help you with that speech or proper swallowing, and our dietitians that help you to understand how your food needs to be prepared to prevent further illness with choking or aspiration pneumonia, to our nursing care, where we have specialized teams that talk and communicate on a frequent basis to help understand what your recovery needs to look like specific to your needs and the way the stroke has affected you. Our physicians also see you daily and help plan your care and work with our therapy teams and nursing teams and our case management teams that are here to help to understand what you have suffered, how we're able to help you, and what's your baseline for the life that you want to have and the goals that you want to have when you leave here at Sky. It can be a scary time, it can be an overwhelming time, but again, we have people that are trained specifically to help develop and encourage and grow and heal folks that have received stroke. So if you or your loved one has ever been in a situation where you've experienced a stroke, please contact us here at Sky Rehabilitation Hospital at 270-782-6900, and we want to help you with hope for what tomorrow will bring after a stroke.